How do you treat a case of dysmenorrhea with homeopathic remedies? How do you take the case of a dysmenorrhea patient? What remedies do you give? In which potency? What is the dosage, repetition? So today I'm going to talk about that in this video. Now, when a patient comes to you with acute dysmenorrhea, you do not have to go into the complete case taking. You do not have to ask more about physical generals, mental generals, past history, family history, etc. Rather than that, do an acute totality case taking. That is, you ask about her periods pain, the location of the pain, the type of pain, the modalities. Modalities are very important. Then you can ask for concomitants. Then if there is any change in the mind, mental sphere during this pain, that is also important. That is how you go about case taking. Now, to cure dysmenorrhea completely, you can't do it in one sitting. When the patient comes to you for acute dysmenorrhea, give the remedy for that pain. Let them get well. And when they come to you for follow up, do a detailed case taking, and you will have to follow up with polycrest to cure dysmenorrhea completely. Now, in this video, I'm going to talk about 6 remedies. Now, in dosage, potency and dosage, you can give from 30 to 1 ml. Repeat them frequently, 2 hourly, 1 hourly. Everything depends on the case. Always the potency and repetition depends on the case. I can just give you a brief guideline here. Everything else depends on the case. So, homeopathic medicines can be used to relieve acute pain. For that, you can use acute remedies. In this video, I'll be talking about 6 remedies. Homeopathic medicines can be used to cure dysmenorrhea completely. For that, you will have to follow up with polycrest, following a detailed case taking. So let me move on to what are the 6 remedies today I'm going to talk about. The first remedy I'm going to talk about is Pulsatla. In Pulsatla, the pain during the periods starts even before the periods begin. A few days before the periods begin, the pain will start. During the pain, the patient wants to sit down quietly. They don't want to move about. So they'll be sitting down quietly with the pain. They don't want to move about. The patient is chilly, but they cannot tolerate warmth. They may be feeling chilly, but they will ask you to switch on the AC or fan. They may want the doors and windows open. So they want to sit down quietly, lie down quietly actually. And they can't tolerate any motion. They can't tolerate warmth. Now, Pulsatla patients will have a sensation of pressure on the bladder. Due to that, they will have this frequent urging to urinate. And this urination, there could be painful urination in Pulsatla. This frequent urination could be painful. Similarly, they have pressure on the rectum as well. And so they have to go to the toilet for passing stools, and little quantity of loose stools are passed in Pulsatla. Now, Pulsatla patients, they may be suffering from anemia. So these patients will have weakness, they will have vertigo also. Anemic patients with weakness and vertigo presenting with dysmenorrhea, you can think of Pulsatla. Mentally, Pulsatla patients are anxious and they may cry. When they talk about their pain, they'll be crying. One remedy to follow Pulsatla is Nagswamika. Nagswamika follows Pulsatla in dysmenorrhea. So remember, the patient will be lying down quietly. They don't want to move. They're chilly, but they won't cover themselves. They want the doors and they want air about them. And there may be painful urination. The loose stools will be passed. They may feel faint. They are weak. They're crying because of the pain and because they are anxious. So that's how you will find the Pulsatla feature. The next remedy is Nagswamika. Nagswamika patients, during the dysmenorrhea, they'll be having nausea. In Nagswamika, the pain will not be limited just to the pelvic area. It can go up to the stomach. It can go further upwards, maybe even up to the stomach. They will be having nausea. Now, similar to Pulsatla, Nagswamika patients can also have pressure on rectum. But Pulsatla had loose stools, whereas Nagswamika has constipation. Now, due to the pressure on the rectum, the patient will have frequent urging for stool. But there are not large quantity of stool or loose stools are passed. It is dry hard stool. Sometimes there are no stools are passed. They simply have the urging. They also have pressure on the bladder and they will be having desire to urinate. Now, this Nagswamika patients, just like Pulsatla, can also feel vertigo. In Nagswamika, this nausea and vertigo are most commonly experienced in the morning. Headache also accompanies the pain during menses. During menses, Nagswamika patients can have headache. They can also have pain and tension in the cervical muscles. That is how you find in Nagswamika. Next remedy to consider is Belladonna. Now, Belladonna has very severe pain, and you have to remember the onset in Belladonna. Sudden onset of pain, and it is very violent. Sudden onset of acute pain will be there in Belladonna. In Belladonna, just like in Pulsatla, the pain will begin even before the menses begin. Now, in Belladonna, there is no gradual onset of pain, but the whole pain comes on suddenly and all of a sudden. And with full force, the pain will come on in Belladonna. Now, the pain in Belladonna is just bearing down sensation. There is no prolapse in Belladonna. It is just that the patient will feel that all the organs will come out through the vulva. And in Belladonna, the patients are not lying down, they are not moving about, they want to sit down quietly. So you will find the Belladonna patients sitting. Pulsatla patients, you saw that they want to lie down quietly, they can't tolerate movement. Belladonna patient will not lie down, they are not moving either, but they want to sit down. And the menses also will feel hot to the Belladonna patient. Headache accompanies, just like in Nagswamika, headache accompanies Belladonna menses. Now you can give Belladonna in alternation with Pulsatla for dysmenorrhea. So remember the acute and violent onset of pain in Belladonna. They want to sit down, they're not lying down, they want to sit down. The menses will feel hot to the patient. There is again headache in Belladonna. And you can give Belladonna in alternation with Pulsatla. Next remedy is Colosin. Again, Colosin again has very intense pain in Colosin. You will find patient having intense pain, and because of this intense pain, the patient is restless. They cannot control the pain. They are moving about. They cannot bear the pain. They are moving about. That is why, because of the intensity of the pain, you will find the Colosin patients bending double. They are bending double due to the intensity of the pain. That is what you will find in Colosin patients, very severe pain. Colosin acts well in most of the cases of dysmenorrhea. You can give potency as high as 1 m repeated frequently. Now, eating or drinking anything will aggravate the pain in Colosin. It will make the pain worse. Now, what Colosin patients really need to control the pain is they need something to support the abdomen. So you will find them pressing something against the abdomen. And what else give amelioration to the patient? Warmth give amelioration to the patient. So you can find sometimes the patients pressing something hot against the abdomen. Maybe they'll be pressing a hot water bottle against the abdomen. They'll be sitting, bending double. They'll be sitting like this, in a bent position. They'll be sitting, they'll be restless, they cannot control the pain, and they want to press something warm against their abdomen. They will not eat or drink during the pain. Another remedy with intense pain is Chamomile. In Chamomile again, there is intense pain. So the patient will stamp her feet. Because of the pain, they'll be pressing their feet and they will try to hold on to something with their hands. So that is the expression of pain in Chamomile. The face itself will show the intense suffering they are having. Now, the mind is important in Chamomile. The patient is very ill-tempered. When you try to have some conversation with them, they are very rude. They will not talk back. They will not talk back to you civil. They'll be rude. You can't hold a conversation with them. They are very angry, irritable because of the pain. Now, Chamomile patients similar to Pulsatla can have diarrhea during menses. Another remedy for dysmenorrhea is cocculus. Now, cocculus you can consider when there is profuse menses. There is profuse bleeding in cocculus patient, and when the patient is stooping down, there is heavy flow of blood. Now, because of this profuse bleeding, the patient will be very weak, so weak that they can hardly stand up. So, in dysmenorrhea with profuse bleeding, one remedy to consider is cocculus, and the patient is very weak, and it is described as the patient can hardly stand up during menses. Another remedy you can think of in dysmenorrhea is Burnemobilis. Now, Burnemobilis is more given by clinical experience than by any particular symptoms. They just have cramps. Now, Burnemobilis are usually given tincture form and it can be repeated frequently. I usually give in almost all cases of dysmenorrhea with another remedy. I give Burnemobilis. That will help relieve the pain in the patient. Now, one thing you have to note while treating dysmenorrhea is some patients, they'll come to you. There are certain patients of mine who come visit the clinic only when they have the acute dysmenorrhea, and that time you can do nothing but give them for the pain. Even after, you have to try to convince them to come up for follow-up, and you have to tell them they will have to take continuous treatment to cure dysmenorrhea completely. It will have to be followed by polycrest remedy if you want to cure dysmenorrhea completely. And don't forget to do investigations wherever required. Blood tests, ultrasonogram, all will have to be done wherever required. Now you can find me on Instagram and I'm there on YouTube. If you like this video, please give it a thumbs up, subscribe to this channel and click on the bell icon.